When we started first talking to physicians about the idea of caring for more acute patients outside the hospital, there was a whole ton of skepticism about whether it was safe, whether patients would accept it, what would it do for workload for the physicians. And I think those are all legitimate concerns, but you fast forward actually a relatively small number of years, and culturally and scientifically and from a regulatory perspective, the world's just shifted a lot. And, I think there's just enormous cause for celebration as we think about patients getting access to these treatments, the path to them getting access to these treatments more in community settings, and just the general acceptance that the home is going to be a super important part of where healthcare is delivered over the next decade. Like, those are enormous shifts in how we think about care in this country.
Try to fix the current system or reimagine something new? Will healthcare ever serve consumers just like me and you? The power's in our hands, but every side's gotta come together. We want the newer generations to get something better. Until we flip the script and talk about what gets prevented. Until we see the changes permanent as if we meant it. Until healthcare is finally consumer-centered. We've got a lot to rap about.
Welcome back to the leading podcast about how consumer health works. We spotlight how healthcare is being designed, marketed, and delivered from the consumer point of view, and profile leaders who are championing the move to preventive care. If you want to understand healthcare both as a builder or operator and as a consumer yourself, this is the place for you. Here's what's going down today. First up, we have the Flava of the week about the launch of the CMS ACCESS Model. Is CMS creating a framework for treating chronic conditions rather than just a short-term payment structure? And how does the model open up new partnerships that can help make preventive health a reality? I'll talk about that. Then Chris McGhee, founder of Current Health, returns to share how the national dialogue about health at home, drug therapies, and consumer experience has changed since he reacquired his company from Best Buy Health. I'm Jared Johnson. Let's get to it. Flava of the week. The CMS ACCESS Model became available on July 6th, and the market's mostly liked what it's seen so far. ACCESS is a 10-year voluntary model focused on conditions affecting more than two-thirds of people with Medicare, including high blood pressure, diabetes, chronic musculoskeletal pain, and depression. It allows approved organizations to receive Medicare payments for improving outcomes in patients with chronic conditions rather than billing for individual services or visits. What's been the market response so far? The response has largely been positive, with many digital health companies, provider organizations, and investors viewing it as a long-awaited Medicare payment pathway for tech-enabled chronic care. More than 150 organizations were selected for the initial cohort, and interest far exceeded available slots. Early commentaries focused on the opportunity for digital health companies to receive reimbursement for services that historically struggled to fit within Medicare's fee-for-service framework, which is great in the short term, though it's potentially even more significant to consider how CMS is creating a framework long-term that rewards organizations for producing measurable improvements in chronic disease outcomes. What's the consumer lens? Access is a big deal for consumers because it's fundamentally a response to healthcare's capacity problem. It opens the door for digital health, AI, remote monitoring, and coaching programs to be rewarded based on measurable results rather than traditional fee-for-service activity. This is the latest foundational pillar of a broader CMS strategy to modernize healthcare through interoperability, consumer-facing tech, AI, and outcome-based payment models. So now that the door is open, organizations must demonstrate that they can identify eligible patients, engage them consistently, drive meaningful behavior change, and produce measurable health improvements at scale. Success will depend on strong partnerships between tech-enabled organizations and physicians, health systems, ACOs, and primary care groups. In other words, it's time to, drumroll please, break the silos and get to work. Let's familiarize ourselves with the new opportunities that are available through CMS ACCESS and prioritize partnerships as the way to make preventive health a reality. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the week. Hey, let's get into the flow, everybody. I couldn't be more excited to welcome my guest back to the show. I'm here with Chris McGhee. He's the CEO and co-founder of Current Health. Chris, welcome back.
Thanks so much, Jared. Great to be back.
So I did have to look it up, but it was February of 2023 that we last had you on. And a few things have happened since then. We can say that, but glad to have you back. And we're going to recount, I think, a couple of highlights of the journey of Current Health that have happened in that time frame. But I'm trying a new way of introducing guests lately. And that is rather than ask them for, kind of their CV, if you will, asking them to kind of boil down their approach or their philosophy, their beliefs about healthcare, about consumer health. If you have to boil that down into like one or two core beliefs, what do you generally believe about healthcare for consumers?
I mean, we've been on a trend for the last, let's call it 100 years, where doctors used to come to people's homes. Then we developed a whole bunch of incredible medicines and equipment of increasing amounts of expense and complexity. And healthcare therefore centralized and became more subspecialized. So we went from a place where you had, your doctor to 100 different subspecialties of just anesthesiology. My wife's an anesthesiologist. And as it centralized and subspecialized, it became probably even more hard for the individual consumer to parse and understand what was happening. If you think about someone who gets cancer, that's an area that we are heavily involved in, particularly in blood cancers at the moment. There's vastly more treatments coming into the market, and those treatments are way more complicated. And for you as the consumer, as it gets more and more and more advanced, it becomes harder and harder and harder for you to understand what's actually happening to you and why, and what's the latest state of the art around research and treatment. And then what happened is we had an explosion around AI over the last few years, where suddenly the consumer is wildly more empowered to understand. And you now see people giving ChatGPT their genome for better or worse, and they themselves are going out and intricately reviewing all of the latest evidence that's out there. So you now have this super powered consumer who understands their treatment and their disease in a way that they didn't before. And that has enormous benefits, and it also has some enormous challenges that need to be addressed. But I think that as we look to the next 10 years, what we've got is a consumer that's much more empowered, that has much more knowledge at their fingertips than they've ever had before, and has an expectation that healthcare is happening a lot closer to where they are and is a lot more accessible in the same way that you can go on Amazon and, I can get something delivered by the next morning. I think the consumer expects that, or it wants healthcare to deliver that level of experience as well. So we're in a time of incredible and really exciting change for healthcare.
Yeah, I'd agree. Like I said, it's been 3+ years since we've had you on, and there has been a journey for Current Health. Maybe you could walk us through a process, because there's been a reacquisition of the company, and then kind of talk to us about your strategy for this chapter of the company, I guess.
Yeah, so I mean, I started Current Health. I was a medical student, but I started the company because of the experiences of my own grandmother. She had COPD, she had heart failure, she had dementia, she had poor eyesight. She kept getting admitted to hospital for things that I thought could and should have been managed at home. And putting someone with dementia and poor eyesight on a general medical floor is terrifying. It's terrifying for someone like my grandmother, but it's also terrifying for the family. And honestly, it's really difficult for the healthcare staff who now have to manage this individual. And so often it's not necessary. So we started Current Health to try and do something super simple, which was, hey, how do we take some of the care that's delivered in hospital, the acute care that's delivered in hospital, and how do you just deliver it in home? And then COVID happened, and I think what COVID did was validate, certainly clinically and operationally, that it was possible to take a pretty decent percentage of care that has been delivered inside hospitals for the last 30 years and deliver it inside patients' own home instead. And when you did that, you gave the patient a better experience, you gave the caregiver a better experience, it was cheaper for the system, and actually you could deliver better clinical care than they were getting in the hospital. We know all these things to be true now. And, I'm super proud that Current Health was and is a big part of that shift. I'd say today, we're still fundamentally focused on how do we take things that have traditionally been done within centralized bricks and mortar facilities and how do we deliver them instead within the patient's own home. And one of the areas where we've been really, really, really focused is very, very high cost drug therapies. What's happened over the last, particularly 10 to 15 years, is there's been this explosion of very, very high cost, very, very high complexity, but in many cases, curative drugs. So that's things like CAR T, which is a cell therapy, all the way through to genetic therapies. And what's different about these drugs is They're much more expensive. They are more complicated to deliver, and they have a higher risk profile. And the consequence of that is patients tended to be kept inside hospital for 2 or 3 weeks after they got that drug infusion. And what Current Health has been doing is providing all of the infrastructure and evidence and intelligence platform around delivery of these very high cost cellular and genetic therapies so that the patient doesn't need any in hospital stay at all. They go straight home. We pick up the side effects of these drugs much, much earlier and help get the patient the right treatment. We help generate the evidence for the pharma companies and the payers to know that these drugs are working effectively. And we help bring down the total cost of care for the actual delivery of that whole pathway. And that's been like super exciting and interesting work. And also, ultimately, I think most people in healthcare want to make healthcare better. They're not in it for money, they're in it to make the system better. And getting more patients access to drugs that can save their life or allow them to live a longer life, like that's just really incredible work to get to be part of.
Yeah, I agree. I agree. Tell us about some other key areas for Current Health right now. Like what else is just driving the day to day? I assume that would include the hospital at home market itself still. And then you had some recent news with Cardinal Health, I understand.
Yeah, I mean, hospital at home remains a big business for us. We see that market still growing. I think, across the US, and especially after Congress rightfully and finally extended the hospital at home reimbursement model to 2030, we see lots of health systems who have capacity problems. They have more patients in their area trying to come into the hospital than they're capable of, than they have beds to treat. And there are stories from all across America of patients waiting, 12 hours in emergency rooms. And it's not because there's not like the ER care to take care of them. It's because there's not a bed in the hospital for them to go to. And what Hospital at Home did was say, hey, the home can be a really effective place of delivering that treatment. And today we support, every single day, somewhere between a third and a half of the US hospital at home market. And we see that business continuing to grow. Uh, But I think like the fundamental point for me is hospital at home, CAR T, other advanced genetic therapies, especially as, some of these drugs start moving into autoimmune and solid tumors. All of this is part of the same thing, which is how do you take the most expensive treatments and most expensive diseases that are in medicine today? And how do you deliver care within those in a different way and in a cheaper way? And, we definitively know that by managing these patients at home, whether it's for CAR T or whether it's for something else, you can deliver same or better care and you can do it same or better experience and you can do it cheaper. And I think that's just like awesome. If you can make the system cheaper, you can make the care better and you can make the patient's experience better. Like you can't really ask for more than that. That's excellent.
Okay, so what's this news with Cardinal Health?
One of the biggest challenges in any of these models has been, and it's particularly true in hospital at home, because hospital at home, there is a lot of logistics to it. There's a lot of stuff that has to go out to the home, be it DME, be it meals, be it, labs, be it our equipment, whatever. And Cardinal Health is obviously like, people at home might not know who Cardinal Health are, but like they're one of the biggest distributors in the United States. They're taking stuff out to patients' homes every single day. It's what they do. And Alex and the Velo Care team, they started up to try and leverage Cardinal's distribution infrastructure to support hospital home programs, and they've been doing that really, really effectively. And I think when we met Alex and the team, it was kind of like a key lock fit for us because we're really great at the technology and we're really great at the clinical service. And Cardinal's really great at the logistics piece. And, it was just a perfect match of, hey, they can make it easier to get stuff out into the home and install it. And, that makes us more effective is that, ultimately we don't work unless we're successfully installed in the patient's home. And that's what they're really, really good at. So there was a natural, relationship that sprung up there and super excited about where we can take that in other therapy areas and in other markets. And I think for us, ultimately, it's just how do we help the customer? How do we help the health system to deliver these really complicated programs and offer them as a cohesive a solution as we can so they're not having to think about all these other things like how do they get technology out there and how do they support it if there's a problem and all that kind of stuff. And that's what Cardinal are really great at.
I want to dig into the advanced therapies piece a little bit. When you're talking about, clearly, this is something that I think makes sense to a lot of people, just in terms of, yeah, I'm sure a lot of these things are expensive. And that might be the depth of knowledge that a lot of people have about something like CAR T, if they haven't, had to experience that for themselves or a family member, or a loved one or somebody they know. What else is useful to know about and understand about advanced therapies, like what all it includes, and why we need solutions to help address some of these logistics? Just help us understand the space a little bit better.
Yeah, so when we talk about advanced therapies, we are talking about very high cost drugs with high complexity of delivery and higher than normal risk profiles. So let's take CAR T as an example, which is one of those advanced therapies. So what CAR T is they come and they take out some of your immune cells from your body, specifically T cells, which are just like little soldiers that go and attack viruses or enemies inside your body. So they take out those T cells, they genetically edit them and re-engineer them, and then they infuse them back into the body to go and attack that specific cancer. And what has happened over the last 10 years is they've found that they are incredibly effective at treating blood cancers. So things like multiple myeloma and lymphoma. And actually in some cases now there's remission rates, over 90%. And, that's just for some patients who might have had a death sentence 10 years ago, that's just not the case anymore. It's like a seismic change in how people will experience diseases like multiple myeloma. And now there's a huge amount of work, and we're involved in a number of clinical trials on this, into can we take that same approach and can we apply it to solid tumors, so like prostate cancer or breast cancer or lung cancer or pancreatic cancer or whatever? And can we apply it to autoimmune diseases like systemic sclerosis? The challenge with these drugs has been, firstly, they're an infusion. So there's that period where the T cells are taken out. Then they have to be manufactured, and the manufacturing process is really complicated and expensive. And then they have to be infused back into your body. And then there's a period where you might be at risk of certain side effects. And those side effects have required a lot of monitoring and assessment and management. And that has been what has kept these drugs, one, within primarily academic medical centres, and two, has required long inpatient stays. And, for lots of patients, the long inpatient stays, the fact that they're only available in certain urban academic medical centres, it means they're just not an option. So we have these incredible treatments coming to market, and actually most people still can't get them. So people are dying needlessly every year by not getting access to these treatments. What we do, working with our absolutely incredible provider partners, is we just completely eliminate that inpatient stay. Patient goes straight home on day zero, and we'll manage them for a period of anywhere from a couple of weeks up to a few months. We look after those side effects. We identify if they're happening earlier. We get them the right treatment if it is happening. The goal is to keep them at home. And ultimately the goal is, A, let's get more people those treatments. And B, let's expand the number of places that can do it. So, a lot of what we're seeing right now is a shift from solely it being delivered within urban AMCs to being delivered more in, or starting to be delivered more in, community practices. And we're providing all of the infrastructure for that. The other thing we're doing a lot in is we're building this incredible data set of, thousands of patients across the country who are getting these treatments. And we deeply understand when are the side effects happening and what happens afterwards. And that data just has incredible utility for understanding how should these patients best be managed. Should there be changes in guidelines and evidence, and how do we take that to the FDA to expand the label for these drugs? And it's just a really exciting and very rapidly changing area right now, where there's just hundreds of these drugs in pipeline and starting to come to the FDA. And we see an FDA right now that's quite aggressive in trying to get these drugs into the market, because they recognize that they can make a just profound difference to patients.
I just want to point out how much our conversation has evolved since the last time we had you on the show, right? Then we did not have the hospital at home waiver extended. And so there was always this cloud above us of, Current Health was placing bets on, that coverage being extended to a certain point. And it was still a case by case approach of, one health system at a time, seeing the ability to come on board, to use the platform that you've created and build a program around it. So not only has hospital at home as a market just grown and exceeded those bounds, those boundaries that had been created at the time, just of the constant hesitation from health systems, those that were able to proceed under those conditions, and then those that were just kind of waiting. And now we have this proliferation of programs out there. And then just to see what the market has enabled you to do. I mean, look at what we're talking about, like these advanced therapies, and the ability to support things well beyond what I would have thought of as the day-to-day things that any platform that's handling care at the home can handle or address. I just think it's important to point out how much this conversation has evolved.
Well, I mean, I think you're right. I mean, when Current Health was founded, there wasn't a single cleared CAR T asset on the market. Like, so firstly, the drugs didn't exist. Like, I mean, this is like 8 years ago they didn't exist. Or 9 years ago they didn't exist. It's crazy. Hospital at home was an academic concept that was in some places being tested, but was largely an academic concept. And honestly, like when we started first talking to physicians about the idea of caring for more acute patients outside the hospital, there was a whole ton of skepticism about whether it was safe, whether patients would accept it, what would it do for workload for the physicians. And I think those are all legitimate concerns. But you fast forward actually a relatively small number of years, and culturally and scientifically and from a regulatory perspective, the world's just shifted a lot. Like now we have 7 of those CAR T drugs cleared. We have thousands of patients receiving those treatments, thousands of them receiving them in outpatient and home with Current Health and through our incredible hospital partners that are doing that work. We have hospital at home used by hospitals all across the country. And I think we have, most importantly, actually, like a cultural acceptance from physicians that the home is a perfectly safe and appropriate place of care for an appropriate group of patients. And I think a lot of healthcare gets this rap for nothing changes, it takes forever. And, hospital at home is a ton of people saying, hey, it's not growing fast enough. But actually, like, if you think about it from the health system's perspective, I look at someone like Mass General, they've done incredible work in hospital at home. Their program launched 5-6 years ago, and now they have a community hospital-sized hospital at home program. If they were building a new hospital, they would not have that up and running in Massachusetts in 5 years. It's moved incredibly quickly, and I think there's just enormous cause for celebration as we think about patients getting access to these treatments, the path to them getting access to these treatments more in community settings, and just the general acceptance that the home is going to be a super important part of where healthcare is delivered over the next decade. Like, those are enormous shifts in how we think about care in this country.
How are you growing your footprint in 2026? Like, kind of where's that growth coming from this point on?
I mean, I think our fastest growing market's in advanced therapies. Every month we welcome new hospitals, new community oncology groups, new providers into our network who are seeking to deliver things like CAR T and bispecifics. We do an enormous amount of work with our incredible pharma partners who are developing these assets and want to see them into the market. And we're also doing a lot of work with payers now because they've been super interested in the fact that we're showing that we can help deliver these drugs at a lower total cost of care. And if you're a payer, some of these developments are pretty scary when you suddenly have these drugs that can be $1 or $2 million coming into the market. And, it's happening very quickly. And I think we're there to help show them that it can be done safely and done to a really high quality. And we've seen a ton of interest from them on that. So I think that's our fastest growing area. But hospital at home continues to grow. And honestly, I think that won't change. I think there are, as I said, still hospitals all across the country with capacity issues. And hospital at home presents a really nice way for them to scale capacity. And, ultimately, if we just remember, like, we know a percentage of patients don't need to be in the hospital. And the hospital, if you need to be in hospital, the hospital's the best place for you. But if we accept, which we now know, that there are a bunch of people who don't need to be in hospital, then let's not have them in the hospital. Like, that's not good for anybody. Nobody wants to be in the hospital if they don't need to be there.
I think we've been able to focus on what a consumer or a patient or a caregiver or a family member or loved one can find in value from the things that you're working on. What about fellow founders in the space? What's your advice to them? I mean, the journey is different for every founder. I understand that. What's been useful as you look back on your founder journey to this point that you'd share with your colleagues?
Yeah, I mean, I think the first and most important thing is you really have to follow the money. Despite the fact that I think most people get into healthcare with really altruistic viewpoints that they want to make healthcare better, the system that we have and the structure of incentives we have, it means that you have to follow the money if you want to get adopted. And what I mean by that is really understanding who's your customer and why are they going to pay and how does it map onto their own payment models, and understanding that those payment models can be really idiosyncratic and not make a ton of sense, and there's a lot of weird incentives. But I think a lot of founders, and I was certainly guilty for this in the early days, they don't think enough about that payment model and why and how can the customer buy what they're buying. And that needs to be almost before anything else. I meet founders all the time who have really good ideas that definitely would improve clinical care, and I know they're not going to get adopted because there's no payment model. And people can think that's a shame or whatever, and it is, but that's the system we have, and the only way they will get adopted is if they map onto the right payment model, and founders need to really, really, really focus on that.
Chris, thanks so much for giving us time today, for coming back on the show. We look forward to having you again, and thanks for everything you're doing to make healthcare truly consumer-centered.
Thanks, Jared. Appreciate it.